All right, finishing up our wrist, hand, and finger techniques. By the time you're here, you've assessed patients' active range of motion of the wrist and you're down to the fingers. You can have the patient splay their fingers all the way out. You can have them bring them all the way in. Again, you've probably done some form of neurologic screening the muscle, or maybe even had them squeeze your hand for grip strength or done a dynamometer. So at this point, you're really just trying to figure out the inert structures of the finger. How does patient do in full extension if I take them in full extension? Better to isolate one finger at a time so that we're not grabbing the entire complex and the nervous structures that sit with it. So I like neutral grip, going one finger at a time. If you needed to go into passive range of motion, end range, you're expecting soft tissue. From the joint perspective, every finger joint, every DIP, PIP, has a convex concave rule, and all of them benefit from a little bit of flexion. If you kind of look from the side, from a little bit of flexion puts them in open pack. So they're all going to be the same for this joint play assessment. Patient position, you're going to find what works best for you. I end up finding I put them in supine or in this because I'm really trying to, supinated, or this position because I'm trying to stabilize the joint, create a little bit of distraction, and then my assessment from there. And we do that at every joint. We create a little bit of distraction assessment. Now here you see I lose my stability. I would then go here if I'm trying to isolate one joint. A little bit of distraction, mobilize. A little bit of distraction, mobilize. These become a little harder to feel in healthy populations, but if you have someone who is post-op or stuck in a cast or any type of sling, finding an isolated segment might be worthwhile. If you're dealing with any type of trigger point release or any slip injury, soft tissue paired with joint mobilization will be helpful. The main take home for a new grad PT would be able to manipulate the hand, be able to get from one joint to the next, be able to distract and produce a little bit of joint play assessment. So if you needed to, I hope you see me kind of like counter forcing in one direction versus the other, you would be able to. Practice the technique of finding the joints, practice knowing where the carpals are. When it comes down to the finger, you'll have a little more reps when it comes to a post-op or a stiff finger.